Tonight on Practical Thursdays, what to do when there's an unconscious patient.
CBRC Laguna is the biggest and leading review center in the province of Laguna, located at with these contact numbers. Enroll now!
Summer is just around the corner. I bet a lot of you guys are already planning your company and family escapades, right? But we have to remember, accidents may happen anywhere, anytime. That's why we have to be ready. So here is what you can do when you see an unconscious person. In emergency situations, unconsciousness of patients can either be due to cardiac arrest or respiratory arrest. And following the chain of survival gives unconscious victims a higher chance of survival. In an unseen circumstance, upon seeing an unconscious person, first, we have to check if the scene is safe. Make sure there are no hazards for you and the patient. The first responder must not be the next victim. Check the responsiveness of the patient. Kneel beside the patient, then tap or shake the shoulders of the patient while shouting, "Hey, are you okay?" and check if there's a response. Number 3, call for help. If the patient is unresponsive, activate emergency medical response by sending a bystander to call an ambulance or a professional medical help. If positioning is necessary, support the head and the neck and then roll the patient on his back. Number 4, check for pulse and breathing. First, lift the chin of the patient and place her palm on the forehead to tilt the head. This maneuver will open the airway of the patient. By opening the airway, you can also check if there are any obstructions in the mouth. Place 2 of your fingers on the groove at the side of the neck beside the Adam's apple and place your ear near the patient's mouth and nose to listen for breathing while watching out for the rise and fall of the chest. Number 5, perform CPR. Now this is crucial. If the patient is still unresponsive, perform chest compressions. Place the heel of your dominant hand on the center of the chest in the middle of the nipple line. Keep your arms straight. Give at least 80 to 100 chest compressions per minute with a depth of 2 inches with chest recoil. Remember to push hard and push fast. This maneuver pumps blood back to the brain immediately to increase the chance of patient survival. Number 6, give emergency breaths. While the head of the patient is tilted back, pinch the nose of the patient and administer full breaths on the mouth of the patient while checking for signs of spontaneous breathing. You can also use a breathing mask if available. Number 7, place the patient in recovery position. When the patient regains pulse and breathing, turn the patient on his side facing you. Did you know that every minute without CPR decreases the survival rate of an unconscious person by 10%? We don't have to be superheroes with superhuman powers in order to save lives. We just have to be aware of basic life support techniques. We ask so you may know. We feature so you may appreciate. We inform so you may decide. We balance so you may judge. I'm Joy Ziranara and this is CBRC News Live Practical Thursdays. Good evening.